Welcome, everyone. It's a lovely Tuesday. I just want to thank you all for joining us on our webinar, A Natural Approach to Men's Health, presented today by the wonderful Dr. Erin Zedek. My name is Dr. Nevner Nibber. I'm a medical advisor with AOR, and I'm going to be the host and moderator for today's presentation. Before we get to it, let's go through a few of our housekeeping items. If you would like to ask any questions, you can certainly do so throughout the presentation. There should be a little question box on the right-hand side of your screen. You can type throughout, and we will be addressing questions specifically at the end of the presentation. So please note that the presentation is being recorded for future distribution, and the content of this webinar has not been evaluated by Health Canada or the FDA. It's educational in nature and should not be taken as medical advice. We urge you all to always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease, and the opinions of the guests and the host myself are of our own and may not reflect those of Advanced Orthomolecular Research, Inc. Okay. Now that that's out of the way, we can meet our wonderful presenter, Dr. Erin Zedek. Like I mentioned, he's a licensed naturopathic doctor and certified sport nutritionist. He practices out of Toronto and focuses on clinical nutrition, sport performance, concussion assessment, and return to sport, school, and work after impact. He travels around Canada with high performance athletes, managing their nutritional and acute rehabilitation needs. So without further ado, I'm going to hand it over to Dr. Zedek.
All right, hi everyone. Thank you so much for joining us for today's webinar. This one is on men's health, and we're going to talk about a lot of different factors that help optimize not just men's health currently, but with aging. So we'll spend a bit of time chatting about heart health, how to optimize exercise output and recovery. We'll talk a bit about prostate health and fertility support, and we're going to also chat about mental health as well. So we're going to jump right in. Heart health is a really important topic, especially in today's day and age. We know that this is an area that definitely targets men, and there's a lot of different strategies that we would like to take to help reduce risk. Some of these, we hope to enact ahead of time, and others we have to make adjustments in the moment. So we're going to jump into blood pressure. We know that, when we're looking at blood pressure and heart disease is one of the leading causes of death in North America. Major risk factors, include being overweight, elevated blood pressure, serum cholesterol plays a big role here, and cigarette smoking. So this one area, blood pressure, is an area that as men, we should be catching quite early on, assuming we're getting a regular routine physical, or if we're in a pharmacy and we have the opportunity to, sit down and do a manual blood pressure check. This is something that doesn't take longer than a minute and provides a whole wealth of information. Hypertension, elevated blood pressure, is going to increase our risk of coronary artery disease, heart attack, stroke, and changes in our peripheral vascular system, so our arteries and our venous return. As we age, we know that our arteries become less elastic and the ability of our venous return changes. This really helps us recognize the importance of optimizing the system through diet and exercise, and if necessary, supplementation, and really doing the best we can to ensure that this system is as fit as possible. We also want to make sure we're addressing risk factors that promote atherosclerosis, so fatty deposits, and arterial calcification. So before we kind of jump further in, we want to know what's normal and what do we look for. So, the typical normal that everyone talks about is that 120/80. The top number is what we call systolic. blood pressure, and the bottom number is what we call diastolic blood pressure. The bottom number appears to have a greater correlation with risk of, outcomes like heart attack, but both numbers are important. Pre-hypertension, so when we start to notice that there are changes in the circulatory system, is about 120 to 139 on the top and about 80 to 89 on the bottom diastolic. Stage 1 we classify once you've crossed 140 but before 160 on the top, and then between 90 and 99 on the bottom diastolically. And then stage 2, this is a very high risk group, greater than 160 on the top or greater than 100 on the bottom. But we want to be intervening far before we get to stage 2. Dietary and lifestyle reduction strategies are critical when we're looking to address blood pressure. Reducing alcohol consumption is very important to this, and we want to make sure that our salt intake is lowered as well. Weight and exercise are correlated not just to cardiovascular fitness, but also fat turnover and a whole host of other health outcomes. So we want to make sure that if we have elevated blood pressure and we are overweight, that we start to direct our focus and attention here specifically. Exercise, we want to make sure that we're getting at least 4 out of 7 days of movement, and that these are at least 30-minute sessions, but we'll elaborate on this later. Smoking is a very important part when we're looking at changing blood pressure and cardiovascular outcomes. Putting positive strategies to help someone recover and stop smoking is very important, and it's something that we want to look at. And lastly, we want to review daily stressors, right? Our day-to-day stress, be it occupational or situational, plays a big role in how we respond. We all know that when we get stressed, that we can sometimes feel our heart rate increase. Sometimes we can feel the pressure, be it in our head in the form of a headache, or even just, feeling our circulatory system. Looking at strategies that reduce our stress, as well as change the way we recognize stress, are a big part of this and things that we want to do. Keep in mind that your blood pressure does change based off of your day-to-day activities. Don't go climbing a whole flight of stairs and then check your blood pressure. It's going to be elevated. We want to make sure that we're testing it at the same time every day, and we're trying to get a consistent idea of what this looks like. Changes in blood pressure can be due to output. So, the heart pumping, it could be changes to our kidneys. We want to catch these changes early and make sure that we're speaking to our medical doctor and our other healthcare practitioners to use proper management strategies and look to see what we can do to help. One of the most well-researched interventions for blood pressure is CoQ10. CoQ10 is an amazing compound that helps assist with energy production within the heart muscle, and it helps promote vasodilation, so helping reduce resistance within our arterial system. The one thing is, a lot of times when we're looking at helping improve other markers of cardiovascular disease, such as cholesterol, we might see statins prescribed. Well, statins can reduce available CoQ10. It actually changes the way we're allowed to use our available CoQ10 and produce. And this is why sometimes with statin medications, we see muscle cramps. And it's really important that if you're on a statin, to consider CoQ10. They are safe to take together. And it is something that will help alleviate the cramps, but also something that can help with blood pressure. 100 milligrams of CoQ10 per day has been shown to decrease our systolic blood pressure, so the number on the top, by up to 11 points, and diastolic blood pressure by up to 7 on the bottom. The magnitude of change with CoQ10 depends on how aggressive your blood pressure is. So those in stage 2 will see a higher magnitude of effect relative to those who are maybe in pre-hypertension. But CoQ10 is important. We see it used for a number of things. but in this context, we like it for cardiovascular support. And as we age, it is very important for neurological health as well. So magnesium, potassium, and taurine are all really helpful for the cardiovascular system. Taurine on its own is anti-inflammatory and helps relax the cardiac system, the circulatory system. It also can help improve renal function. We see when we combine magnesium with taurine that we will see improvements to blood pressure, we'll see insulin resistance improve, and plaque formation on arteries is going to reduce. Potassium as well helps relax smooth muscle, so that helps keep our cardiovascular system from being too rigid. So our arteries, who are responsible for, expanding with blood and then contracting to help push blood on, we want to make sure that this is a relaxed system to be as elastic as possible. And magnesium, of course, promotes relaxation of cardiovascular muscle as well. The most important thing is, depending on your medications, potassium might not be indicated, which is why AOR has a whole host of different options, from just taurine to magnesium with taurine to magnesium with potassium and taurine. So it's important to select the one that's right for you and to consult with your physician to make sure that it's indicated and safe with any medications you might be on. Moving onwards, cholesterol. Why should we care? A lot of times people are told, hey, your cholesterol's a little high. And this is something that a lot of times it's easy to ignore, because high cholesterol isn't something that we feel. It's not something that men will notice in their day-to-day. It's not something you wake up and go, oh, I think my cholesterol's a little high today. This is a silent player when we look at cardiovascular risk. But increased cholesterol is associated with increased risk of coronary heart disease and blood clot incidents. So when we're looking at atherosclerosis in particular, what we see is when cholesterol is in high amounts, especially LDL, this is our bad cholesterol, we can see changes in the way fat deposits on our arterial system and the way it's called foam cells develop. So this is our natural reaction to increase LDL. And what happens is we start to change the thickness of the walls of our artery. Well, this is going to shrink the diameter of our blood vessels. And this, of course, can change a whole host of factors. It's going to change resistance within the arterial system, so that can increase blood pressure. It's going to obviously change the space of that tunnel that blood flows through, so it increases chances of a clot getting lodged. So obviously this is a major issue. And we want to make sure that the relative inflammation that is caused by these fatty deposits decreases, when fatty deposits occur on our arterial system, what happens is we start to see changes in adhesion molecules on the membrane of our arteries, which unfortunately increases the risk of clot formation, which isn't good either. So we want to make sure that we are looking at our food and our diet, and that we're understanding when we see bad cholesterol showing up on our labs, and looking to change our diet and lifestyle to best address this, hopefully before we have to consider medication interventions on the pharmaceutical side. But if we are doing pharmaceutical, there are options that work really well. So, cholesterol reduction strategies, there are a number of things, and it's so important to just look at what you can do in your daily lifestyle to improve each day, week, month. Little changes, big results. Eat more frequently. Obviously, when we're reducing the sizes of our meal, the chances of overconsumption decreases. Being very careful of high temperature cooked foods and processed meats. The development of advanced glycosylation and glycation end products, does have implications to insulin function and overall cardiovascular health. We want to make sure that our dietary fiber intake is high. Fiber helps make sure that we're turning over our cholesterol well in the intestine, that we're trapping in bile and eliminating, and avoiding fructose and refined sugars. Looks like my dog is trying to bark at the door. Sadie, that's enough, thanks. Uh, Fructose is an important one. Now, fructose and refined sugars on their own, when we have a really high intake of these, when we're not using it for energy, if we're inactive or have a low activity status, unfortunately, the body will take fructose and other refined sugars and undergo lipogenesis. So convert these over to fat. And of course, our cholesterol are the trucks that drive around these fats. So obviously, if we have a diet that's super rich in fructose or high fructose corn syrup and refined sugars, or white breads or white pastas, this can have long-term negative outcomes. So we want to make sure that we're avoiding it. To be clear, this is very different than, say, the sugars that we see or fructose that we see in fruits, which come with it beautiful sources of fiber. And when we have sources of fiber with it, we don't see the same lipogenic activity. Now, this is the tough one for a lot of people, considering elimination of things like coffee. I understand some people just need that coffee to get going on their day, but there is a correlation between coffee and high cholesterol. So it is something that if you're in the super high risk category for LDL or some of your advanced cholesterol fraction metrics, it is something that you may want to consider. And then above all else, improving healthy dietary fat consumption, raw olive oil, omega-3 intake, things like almonds and our omega-9s, and then of course eliminating trans fat intake. Nirad and I went to the same school, and I'm sure she heard the same quote in our second year nutrition class, but the scariest statistic I ever heard was that trans fat increases risks of all-cause death by approximately 400%. This is scary, and we should be looking to screen our foods for trans fats on the label, but also looking for partially hydrogenated or hydrogenated oils. These have a very similar, if not the same effect. And sometimes trans fats will be labeled as partially hydrogenated oils. Fats to avoid, be careful cooking oil sourced from corn, sunflower, and safflower at higher temperatures. They're unstable. They create a lot of reactive oxidative stress, which is not healthy for our cardiovascular system. We want to make sure that if we're using, say, a safflower oil, that we're using it more in a raw capacity. AOR's cholesterol control is a really, really fascinating, looks like the webcam dropped. Hopefully that comes back. It's a fascinating product that's very effective, maintaining healthy cholesterol levels, reducing total cholesterol, LDL, and triglyceride levels, and even has a small impact increasing HDL. HDL is our good cholesterol, and we generally find that one of the only ways to increase this is through exercise in particular. This is a high flavonoid containing product, and we know that flavonoids, those who have a higher flavonoid intake, when we look at some of the retrospective cardiovascular studies in particular, we see that risk of cardiovascular disease becoming fatal is 18% lower in those who have higher flavonoid intake in their diet. So AOR has sourced their flavonoids from orange, actually, and it's a really effective option where we see a significant reduction in our bad cholesterol or LDL by about 23 to 39%. And HDL actually increased as low as 17%, but as high as 39%. What's impressive as well is this has been looked at in combination with rosuvastatin. So it is safe to use with certain cholesterol medications. Vitamin E also reduces cardiovascular risk by regulating cholesterol metabolism in particular and changing the way we see fatty deposits and inflammation along our cardiovascular system in our arteries in particular. We do see a lower risk of heart attack. And the one important thing I always tell people with regards to vitamin E is you never exclusively want to be using just one form like alpha tocopherol. You want to use a form that has all 8 forms of vitamin E, so our tocotrienols and tocopherols. And this is because when you use exclusively one form, you end up depleting the others. And this can be a problem because certain forms can decrease cancer risk, for example. And we want to make sure that we're balanced. So, alpha has been shown to lower heart attack risk, but gamma has great cardiovascular benefits as well. And if you dose too much alpha, you end up lowering gamma. So you want to actually be giving them together. We see reduced platelet aggregations and clot formation. And above all else, we see improved nitrous oxide synthesis for blood vessel dilation. So we like this. So let's move on to exercise. Those that have heard me talk before know that this is a very near and dear topic for me. And we'll talk a little bit about how we can improve protein requirements with aging as well. So with exercise, we always say move it and lose it. Obesity and reduced insulin sensitivity are major risk factors, not just for men, but for women, that contribute to atherosclerosis and ischemic heart disease. Exercise helps everything. It's really easy to say that. Reduce stress, reduce BMI, total cholesterol improves, your blood sugar regulation improves. We see improvements to cardiovascular fitness and respiratory function. We want to make sure that we're exercising at least 30 minutes in duration and no fewer than 4 days a week. This is important. And I always say, don't just focus on cardiovascular fitness or strength and conditioning. It's so important that we're looking at both. There are countless benefits. Obviously, when we're looking at cardiovascular fitness, this pays dividends not just now, but later in life. Lung capacity improves as well. And then with strength and conditioning, we want to make sure that we have improved muscle mass. This helps us when we're looking at resistance against falls. This helps with improved joint mobility, assuming we're not going full body bulking. That might change, but we can improve strength outcomes at a very safe rate. We want to make sure that we're exercising regularly and often, and we see improvements across the board. Protein is critical to making sure that we're healthy and we're maintaining muscle quality. If we're looking at the Canada Food Guide, we're looking at the recommended dietary intake of about 0.8 gram per kilogram. Anything above that, if you're reading papers, keep in mind is going to be called a high protein diet. That's not necessarily true in my opinion. It's important that when we're looking at athleticism and for really exploring all the capabilities that our body can do as men, we want to make sure that we're feeding our body healthy, lean, high quality protein. So if we're using chicken, be sure to remove the skin. If we are having a cheat and choosing red meat options, we want to choose leaner cuts like a fillet. And really just make sure it's as lean and clean as possible. When we're looking at active individuals, it would appear as though the research favors an intake of about 1.4 to 2 gram per kilogram body weight. The 1.4-ish range is better if you're doing cardiovascular activities, going up to the 1.6, 1.8, and 2 if you're doing more strength and conditioning. Protein does have different effects as we age. As we age, our muscle becomes a little less responsive to protein. And this is really important. So we need just a little bit more protein to get the same result when we're looking at muscle response. So to improve muscle protein synthesis, when we're young and we're in our 20s, we really only need about, 1.5, 1.7 grams of leucine, the amino acid that really stimulates our muscle protein synthesis and our recovery from exercise, our repair. as we age and we get, into our 40s and 50s, that becomes, 2.3, 2.5 grams per serving. So it's really important that we're keeping that in mind when selecting a protein source. AOR has an advanced whey. It contains 22 grams of protein, and it's a nice combination of isolate and concentrate. This is a great immune support as well because of the lactalbumin and lactoferrin, which also helps improve iron fractions as well. Really nice, especially if we're coming out of an infection and we're trying to get back to exercise. Branch chain amino acids, as I said, leucine is the king of the branch chains. It's the one doing the heavy lifting. And if you're vegetarian or vegan, you will want to make sure that you're adding branch chain amino acids or leucine regularly to make sure you're getting that leucine content to ensure muscle protein synthesis occurs. The other area where we see branch chain amino acids really helpful is to decrease DOMS, so delayed onset muscle soreness, that feeling where, we're just after our workout, we just feel like we've been maybe hit by a bit of a truck, and we're looking to help reduce that so that maybe we can work out the next day and keep going. So it's nice that we can see reduction in muscle damage and improvements to endurance and resistance exercise with it. And, I've selected a lot of interventions in this talk that cross over a lot of different topics. And obviously there's benefits when we're looking at taurine. And arginine and citrulline also seem to help improve fatigue during exercise, which we like. Importance of testosterone. So when we're looking at men's health, testosterone is obviously very important. Testosterone, as men, we have an advantage, right? We have increased protein formation and muscle development. This is why we see such rapid muscle development and bone development in puberty. Higher basal metabolic rate comes with the increased testosterone, right? This can be anything from a 5 to up to 15% elevation. This is, one of our secret weapons. When you start exercising, even if you're sedentary, if you haven't been exercising in a while, either from, lifestyle choices or even just injury, this is how you are able to get back at it, right? Your testosterone will be there to support you, and your ability to get back to exercise, you have a natural advantage. Role in bone growth. Testosterone is very important to increasing the thickness and quality of bone and calcium deposition. So this is another advantage that we have as men, and it's really important as we get later in life and we look at something called andropause or testosterone deficiency syndrome, where we start to see decline of testosterone, which comes with the potential for hair loss, depending on your genetics as well, decreased bone density and increased risk of fracture, and we start to see an increased estrogenic presentation as our testosterone starts dropping. So our estrogen doesn't necessarily rise, but we start to see it a little bit more, and the potential for central adiposity, so fat around the abdomen and maybe around the pectoral area, changes as well. So as mentioned, we really want to be smart about how we approach aging. So this is where we have an opportunity early in life, but we can also make changes that help later in life as well. If we are able to exercise and get those healthy habits earlier in life, then we will see better bone health, better injury risk reduction, right? We just have better muscle quality. This is important. And as we age, it's so important to continue to exercise. So even if you haven't been exercising, it's important to try to start, even if it is later in life, because that resistance-based exercise will help improve bone health. So we want to see that. The importance of diet also plays a very critical role when we're looking at aging. As men get later in life, the need to reduce things like red meat and improve healthy fat intake becomes a lot more important to address. And obviously, if we address this earlier in life, the benefits are there. But we want to see these changes as we age, especially to support healthy testosterone function. You have these opportunities to change at any time in your life. We can choose to stop smoking. We can make sure that we change our alcohol intake and really support positive, healthy changes. There is no time that is too late to start. Obviously, the earlier we make these changes, the better. The last thing I will say is with regards to exercise and weight control. Between the ages of 50 and 70, we see that there is about a 3-time reduction in mortality when we look at those who exercise versus those that don't. And the most important thing is, as we continue to push exercise, we see that there's a notable improvement in what we call healthy years. So the amount of years that we're in good health relative to our sick years that can occur later in life due to a variety of conditions and obviously infections. So now we're going to jump into male reproductive health, a little bit of fertility support and prostate health, and things that are important specifically to men. So we've already kind of touched on a lot of these, but it's really important to talk about some of the things that change testosterone and health of our sperm, right? Obviously, we're looking at supporting the gonads, so the testes, as well as the prostate. And we're going to talk a little bit about these factors in particular. So alcohol, we know that increased alcohol intake has a direct correlation with poor sperm production and function. For men who are trying to conceive, really look to reduce or eliminate your alcohol. This is a big thing to look at. Smoking. Smoking is, we've already mentioned, a big risk factor for so many things, but it is associated with a low sperm count. We actually can see increased carbon monoxide levels within the testes, and we see introduced lead into the seminal fluid. That's incredible. It's not a good thing when we're seeing these compounds in sperm. And obviously, if you are smoking, you want to make sure that you try different strategies to stop. Cannabis, important, especially with legalization in Canada. Cannabis can decrease testosterone, so this is something that we want to look at, especially in those looking to conceive or having issues with their overall testosterone and energy. It's something that we can see bounce back relatively quickly with cessation of cannabis in particular. And lastly, phthalates. So phthalates are compounds that we see in a lot of day-to-day household items, including personal hygiene items like shampoos. Different cosmetics have them, but a lot of aerosolized compounds and different workplace exposures can occur as well. These have the ability to decrease testosterone, lower zinc, and actually change the weight of the testicle. So we don't necessarily want to see that. So what can we do to improve fertility? Obviously, stop all the things in the previous slide or change their frequency. Watch your phthalate consumption in your personal care products. If you see it in your shampoos and different things, pick a different product. If you are exposed occupationally, do your best to wear PPE and reduce. And then, of course, reduce your stress. Coming back to stress, when we're under extreme physical and mental stress, we do see changes to our testosterone. And we want to see our exercise output improve, right? When we are exercising, we see reduction in stress. Higher quality testosterone can come from this as it helps drive muscle repair. But the importance is, please, please, please do not burn it to the ground. Don't do that. Because when we see high output, excessive strength and conditioning, really ultra marathon ranges of cardiovascular output, this is something, especially if you're doing 2-3 workouts a day, that we can see change testosterone. to the negative in the short term. We want to make sure that we're recovering properly. This is a big part. So exercise is good. Burning it to the ground, if we're feeling worn out, wired every single day, and we feel like we're overdoing it, you probably are. So be smart, make changes. Dietary changes that help improve fertility outcomes, healthy fats like omega-3s we want to incorporate, increase lean protein. We can look at foods that are rich in selenium, like Brazil nuts. Don't overconsume one Brazil nut is fine. And just be cautious with heavy iron intake because it can damage sperm DNA. So we can talk a little bit about what options exist on the supplement side to help with improved sperm and fertility outcomes, so sperm motility and quality of DNA. So arginine, we see improved blood flow specifically to the testes and to the penis and erectile quality. Sperm count and motility also improve with arginine. Zinc is really important, not just for sperm quality, but also for prostate health. Zinc is involved in the most amount of reactions in your body, from liver all the way to prostate. But zinc in this context helps prevent sperm DNA fragmentation and oxidative stress. Selenium we've mentioned already, but deficiency is linked to poor motility and deformed sperm. So we want to make sure it's addressed. We can test for it, but also sperm plays a really important role with vitamin E and helping keep vitamin E in circulation to help reduce stress on the liver. The reason why we've got magnesium synergy on here is magnesium synergy has all the different cofactors that help boost magnesium use in the body, including selenium and zinc. So we definitely like this formula because it's got a lot of different things. Obviously, there's no NPN claim with regards to fertility. It just has the nutrients that we're talking about today. So let's talk a little bit about erectile dysfunction. This is one of the most common male health complaints that we see. It's also a topic that is a little taboo, and we want to see it brought to the forefront. We want to make it easy to talk about and improve open conversation because it is a problem that can be addressed. But we want to make sure that we're looking at the different causes and what could be contributing. So, you know, you guys see the list in front of you. We see diabetes, cardiovascular disease, hypertension, obesity, lack of exercise, cigarette smoking, benign prostatic hyperplasia, stress, and then different medications, including SSRIs that might be used to treat depression. So when we're looking to approach erectile dysfunction, we want to make sure that we're addressing as many of these factors as possible. Stress isn't just looking at mental or physical stress, but also how we're sleeping. As a bit of an anecdote, back when I used to work in retail natural health, I'll never forget one gentleman who came in and he was trying everything to help improve erectile function. He was just not seeing the results. And he was quite young. He was in his late 20s. And the one thing he didn't tell anyone was, you know, he actually was only sleeping 1 to 2 hours a night and just really burning it to the ground. And you can try any intervention under the sun, but if you don't give your body a chance to recover, you're not going to see global outcomes improve. So in fact, when we saw sleep addressed in this individual, it was impressive to see how quickly he reported that erectile function came back. So just a reminder that we have to look at all factors of stress and how we're recovering. So let's have a little talk about medication-specific erectile dysfunction. SSRIs are common with regards to changing erectile quality as well as orgasm quality. So we see this with a lot of different SSRIs, including fluoxetine and citalopram. So we're looking at Prozac and Cipralex. And what's really impressive is saffron, which is a really high antioxidant containing herb that also has a beautiful B vitamin and mineral backbone. We see that saffron helps not just with depression, it actually has fantastic depression metrics, but when given with fluoxetine for 4 weeks, we see improvements to erectile dysfunction. And this is wonderful. So the idea that someone who is seeking pharmaceutical help with depression, a lot of times we just don't have interventions that can be safely combined with SSRI medications. So saffron has that research with it. There are a number of papers, so 4 studies in particular, that have looked at that and seen safety, which is quite nice. But saffron in particular has 12 randomized controlled trials looking at mild, moderate, and major depression, where we see it compared to placebo as well as other SSRIs. And we see significantly positive effects with saffron, very comparable to what we see with SSRI medication. So I think it's really important. I think it helps, and it's something to consider when medications are present. Oops. Arginine is also a very popular intervention when we're looking at erectile quality, keeping in mind that the erectile system depends on nitrous oxide production. Arginine is a precursor to nitric oxide along with citrulline. And, we've seen doses as high as 5 grams per day, research to show improvement. What's interesting about this is it would appear as though when it's dosed closer to intercourse that there's better outcomes. And this makes sense. We talked about arginine with regards to helping with other cardiovascular health factors, specifically arterial vasodilation. So we know that arginine is a amino acid that is in high demand when we look at other organ systems. So when we're looking at intercourse, we want to make sure that the arginine is dosed close to activation of this system so that it can be used appropriately. So let's talk a little bit about prostate health. So obviously the prostate is important because it helps secrete that milky fluid that adds bulk to semen, and it enhances the motility and fertility of sperm. It's also important for helping convert the testosterone that is produced in our testes into DHT, dihydrotestosterone, which is one of the more active forms of testosterone. Over time, DHT is going to result in significant swelling of the prostate gland. And as a result, benign prostatic hyperplasia will develop for almost all men. It just depends on when in life that we'll see it. And we'll see different complications from increased urinary frequency, urgency. We might see changes to how we void. Getting up at night becomes a lot more common to go pee and decreases in urinary force. We may also see an increase in urinary tract infections as well, with that related to increased urinary retention. So AOR's Prostate Support is a wonderful supplement that reduces the size of the prostate and helps relieve symptoms of the enlarged gland. It is a pollen-based extract in particular that we see really help with inflammation. There's improved flow rates, residual volume, but what I love about this is by using pollen, we see similar outcomes to using a herb called Pygeum africanum. The problem with Pygeum africanum is it's very endangered. So it's nice to see an option available on the market that doesn't depend on an endangered plant. You see results within 3 to 6 weeks, and use has been studied up to 1 year, which is quite a long period of time when you look at natural health products. Depending on what else is going on, you might need to look at interventions that help deal with the UTI. So anything with D-mannose or cranberry is great for this because it changes the way bacteria can adhere to the membrane, to the walls of the ureter, which is really nice. So AOR's UTI cleanse is nice. And AOR just came out with a product called Bladder Support, which helps reduce symptoms of urinary incontinence, as well as help improve nighttime urination. It also tonifies the elasticity of the bladder and improves collagen, which is quite nice within the bladder itself. If someone is not able to void, so they are completely unable to urinate, don't use something like Bladder Manager. You have to refer to the medical practitioners. And that really brings us to the end of our men's health review. I'm going to open it up for questions. I hope you've enjoyed this conversation. One thing I didn't mention is when looking at prostate health, make sure you're looking at zinc. When zinc concentrations are higher, we don't see as much conversion to DHT, which helps keep swelling of the prostate gland under control. Again, thank you so much for joining us for this conversation on men's health. Again, men's health is something that should be discussed openly. Obviously, it is November, so hopefully we'll see a lot of mustaches out there, and we will see a lot of attention directed towards prostate cancer. I'm going to open it up should there be any questions, and thank you all so much for joining me today.
All right. Okay. Thank you so much, Aaron. That was just so informative. I feel like we covered so many different topics in a really succinct, manageable way. Now, we do have a few questions coming in. I just wanted to start off the conversation with a question we had in regards to testing, because we do have a lot of practitioners in terms of testing, particularly for prostate health. Do you kind of have any guidelines or recommendations on when you'd be doing testing with a lot of these products, particularly the Prostafil?
Sorry, so just to be clear, the question is regards to prostate-specific testing and use of prostate support?
Yeah. How frequently
Yeah.
would you be doing that testing?
So obviously we want to make sure that we're testing for markers of potential incidence of prostate cancer. Depending on familial history, those who have an aggressive familial history of prostate cancer, we want to start checking them a lot earlier, be it digital rectal exam or or PSA. There are other advanced markers of prostate support, but in Canada, we're just not seeing those used as much at this time. The answer for prostate support, in my opinion, is when you see symptoms, you want to start addressing it. Up until then, we want to make sure that we're using proper dietary interventions. Obviously, things like lycopene, wonderful antioxidant, in tomatoes, making sure this is incorporated into our dietary lifestyle. I think for men, you know, we should be cooking a lot more with tomatoes. There's a lot of benefits. We have a lot of niacin in tomatoes. So we see improved mental status. We see a lot of energy production improvements. And keep in mind for lycopene, the more you actually heat and break down tomatoes, we actually see more lycopene produced. So we want to make sure that we can make dietary changes along with, you know, supplemental ones.
Excellent. Okay, we have another question in regards to the link between testosterone and stress. If you could speak a little bit more to that.
So when we see high amounts of physical stress in particular, we tend to see testosterone drop. In fact, in sport, one of the most interesting phenomenons is the drive towards testosterone exemption lists. Now, this was a dirty little secret within sport for a long time, where certain sports allowed, if say a male competing had really low testosterone that they could prove on labs, they were allowed to actually dose testosterone supplementation, obviously pharmaceutically. So what individuals would do is they would, create as much physical stress as possible. 3 workouts a day, heavy weight lifting right before the lab test, because this will suppress testosterone. And what they would say is, oh my gosh, you're not producing your testosterone, and we would have to then say, yes, you're a candidate for testosterone replacement therapy, and that's a problem. So we can extract a lot of this information and apply it to just men in general, where we say, listen, if you are a male who is undergoing excessive strength and conditioning training, and I do mean excessive, nighttime workouts, 3 times a day, both cardiovascular and strength and conditioning, this can be too much. We can overload the physical system. Mental stress, we know that mental stress and libido changes are also tightly related. So we do see changes on that side as well. So it is something that I just don't think we talk about enough. And when we're looking at our male patients, we really should be asking them, hey, do you feel rejuvenated after your workouts? Do you feel accomplished? Do you feel strong and powerful? Or do you feel depleted? Right? And this assumes that we're doing all the right things post-workout. This assumes that we've got good, high-quality protein. This assumes that we are replacing our carbohydrate stores and we're making sure that there's bioavailable energy. And if we're doing all these things correctly and we're still not seeing improvements to, energy, libido, mental health, then there might be an issue when we're looking at the adrenal glands and steroidogenesis. So this is something to consider. Great question.
So our next question is, what type of zinc do you prefer using?
To be honest, I'm actually pretty comfortable with a lot of the research on a variety of the different forms of zinc, zinc citrate, zinc picolinate. All of these have got positive research. I don't necessarily think that the form of zinc is as important as to how we balance the zinc. Zinc must be balanced with copper. I am a firm believer in this. The more zinc we drive into the system, especially in times of immune support need, when we're seeing doses as high as 50 milligrams per day used for months, some people will do, that will drive your copper down so significantly. And for those who are struggling with anemia, if you can't fix the copper issue, you will not see iron improve. Copper is so critical to helping pull iron out of the enterocyte, right? If we don't have copper in the right form, in the right amount, we won't get iron out of that wall of cells, and we'll just see it sloughed off, and now our iron is leaving as part of our bowel movements. So for me, it's about the balance of zinc. Usually we want to see 15:1 is the ratio we like to see. Obviously, if you're just doing short-term zinc supplementation, do you absolutely need to balance with copper? No, short-term being like, week to 2 weeks. But if you're going to use higher doses or consistently use them, I do recommend balancing with copper. I think that's one of the things that the magnesium synergy formula did so well, is it has zinc with copper balance, as well as obviously AOR zinc is titled zinc copper balance. And that was something they were tuned in on that research very early on. So we'll give credit where credit is due.
That's a great point. Yeah, I don't think people necessarily talk about minerals, and I mean, we talk about forms a lot, but how it balances with other minerals is so important. So our next question is in regards to arginine, safety with arginine. Are there kind of concerns or considerations that make you use more the arginine pathway versus just the potassium nitrate type pathway?
Great question. So let's address, first question was, are there any concerns we should really look at? So with arginine, obviously keeping in mind if you have a patient with a history of herpes simplex, so either cold sores or genital herpes, higher arginine can suppress lysine ratios. This isn't good because this can promote viral replication. So we want lysine to be a lot higher than arginine in this condition. The higher we can push lysine, the lower incidence of cold sore and hepatic lesion presentation that occurs. Obviously, stress plays a big role in that as well. In healthy individuals, we've seen arginine used in really high doses quite safely, like 5 grams. Bodybuilders love it because they get it, they get the pump with it, which is quite nice. We do see arginine used for cardiovascular fitness and erectile function. With regards to which pathway, you hit it right on the head, whoever asked that question. Yes, there are a lot of ways to activate this pathway. We could be using something like NOx, where we're using like a potassium nitrate that really addresses different parts of this pathway. The answer is it depends on the patient, depends on the situation. AOR does have cardio NOx, which combines CoQ10 with our potassium nitrates. So you do get that nitrous oxide support with CoQ10, which is nice. So it really depends. I personally like arginine when I'm looking at more musculoskeletal, just because that's where the research seems to be. NOx does have some sport research, but it's not as strong. So that's where obviously my attention has been. Keeping in mind if there are reasons why low amino acid should be considered. So in the cases of kidney damage, don't look at this as an intervention.
Yeah, good point.
And that goes for all protein.
Sorry, say that again.
In the case of kidney damage, and obviously we've done a lot of talk on cardiovascular fitness today, if there is nephrotic syndrome, obviously if we do have depleted kidney function, high protein diets are not to be considered, and you really want to keep them low protein, just enough to get the job done, but not so much that you're causing undue stress. Obviously, when we have protein leakage through the kidneys, this pulls water with it, and you don't want to be changing volumes because this can change edema fractions as well.
Mm-hmm. Now, you had mentioned the pollen and the prostate support. Are you aware of any of the like the kind of the allergenic potential, particularly with patients who are allergic to pollens?
I'll admit that's a bit of a blind spot for me. I am a firm believer in admitting when the answer is I'm not sure. And in this case, I am certainly not sure. My advice is if you're allergic to pollen seasonally as opposed to anaphylactically, it's something you can certainly try and see if you have an increase in things like congestion or histamine response. But if you're anaphylactic, if you have any sort of anaphylactic response with regards to bees or pollen, I'm not sure. So that's something I just simply don't know. I'd have to look up.
Yeah, and actually, I can speak just from the sourcing perspective of that. The source does have a much reduced allergenicity because they do clear out a lot of those potential allergenic proteins. However, it's not guaranteed. So we do always caution, particularly with that product, that if you do have a sensitivity or an allergy, to avoid use and or do a test. But yeah, we certainly wouldn't want to put anyone at risk, as you just said, who's got an anaphylactic reaction. Okay, so we are kind of coming up to the end of our time here. We're so appreciative of that really comprehensive overview, and I think it gives us a lot of jumping off points where we can really make well-rounded recommendations and suggestions to our male patients. We appreciate your time and your insights. If any questions come to you later, or you have any concerns accessing this video in future recordings, you can send over an email to marketing@aor.ca. That's marketing@aor.ca. For future webinars, please check out aor.ca/webinars with an S/B, the number 2, and the letter B. Thank you all so much for joining us. Have a wonderful and safe afternoon. Bye-bye.
Thanks for joining us, guys.